Have you ever noticed a small change in your body and thought, it's probably nothing? A little fatigue, a mild pain, or a slight cough that just won't go away? Most of the time, we ignore these signs, thinking they're just part of getting older. But what if they aren't? What if your body is desperately trying to warn you about something serious, something life-threatening? Doctors say that after 60, there are 6 critical symptoms that should never be ignored. These signs might seem harmless at first, but they could be your body's final warning before a major health crisis strikes. From unexplained weight loss to sudden dizziness, these symptoms could indicate anything from heart disease to hidden cancers. The scariest part? Many people overlook them until it's too late. In this video, we'll break down each warning sign, explain what it could mean, and, most importantly, show you what to do if you experience them. Stay with me until the end, because this information could literally save your life. Now, let's get started. Number 1. Unexplained extreme fatigue. There is a big difference between feeling tired after a long day and experiencing persistent exhaustion with no clear cause. If you're getting enough sleep, not overworking yourself, yet still feel completely drained and lacking energy, this is not normal. This isn't the kind of fatigue that a nap or a cup of coffee can fix. It lingers, weighs you down, and most importantly, it has no obvious explanation. Many older adults accept fatigue as a natural part of aging, but in reality, chronic exhaustion can be a warning sign of serious health issues. One of the most common causes is heart disease. When the heart weakens, it struggles to pump enough oxygen-rich blood to your body, leaving you feeling drained even without exertion. Kidney disease can also lead to fatigue because your body loses its ability to filter toxins, causing imbalances in electrolytes. Thyroid disorders, especially hypothyroidism, slow down metabolism, making you feel sluggish all the time. Even more concerning, some types of cancer can cause severe energy loss as the body diverts resources to fight abnormal cells. Think about this. You used to love your morning walks, but now just stepping outside feels like an overwhelming effort. You no longer feel like cooking, talking to your family, or even handling simple tasks like folding clothes or holding your phone. At first, you might dismiss it as a sign of aging, but over time, it only gets worse. If this sounds familiar, your body is sending you a message, and you need to listen. So what should you do? Don't ignore these signs. Ask yourself, when did this fatigue start? Am I experiencing other symptoms like dizziness, shortness of breath, or swelling? Is it interfering with my daily life? If the answer is yes, don't wait. See your doctor and ask for tests to check your heart health, kidney function, thyroid levels, and other chronic conditions. Your body doesn't just shut down for no reason. If you feel drained despite not doing anything strenuous, this isn't just tiredness, it's a warning sign. Catching the problem early can help protect your health before it's too late. Take care of yourself today. If you're still watching this video and find these insights valuable, comment 1 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Thank you for your precious time, and remember, every step you take today brings you closer to a happier, more fulfilling life. Number 2. Sudden and severe chest pain or pressure. There is one sensation you should never ignore: a tightness, pressure, or intense discomfort in your chest. Don't dismiss it as something minor. When a doctor hears someone describe this feeling, they immediately think of one thing: a heart attack or an aortic dissection. And if you wait too long, the consequences could be far more severe. Not all heart attacks look like they do in the movies, where someone suddenly clutches their chest and collapses. In reality, many heart attacks start quietly, with a heavy, squeezing, or burning pain in the chest that sometimes spreads to the arms, neck, jaw, back, or abdomen. Some people experience nausea, dizziness, shortness of breath, or cold sweats without realizing that these are serious warning signs. One of the biggest mistakes people make is confusing these symptoms with heartburn or muscle pain. They assume it's just overeating, stress, or overexertion, so they wait, hoping the discomfort will pass. But waiting can be a deadly mistake. If the pain lasts more than a few minutes, comes on suddenly, or worsens over time, your body is sounding an alarm, and you need to act immediately. Imagine this scenario. You're sitting on the couch watching TV when you feel a tightness in your chest, slight shortness of breath, and a dull pain radiating down your left arm. You think, maybe I just pulled a muscle from lifting something heavy yesterday. You drink some water, change positions, but the feeling doesn't go away. A few moments later, you start sweating cold and feel dizzy. This is not normal discomfort. This is an emergency. So what should you do? Don't ignore it. Don't wait to see if it goes away. If you feel severe chest pain or any of the associated symptoms, sit down, stay calm, and call 911 immediately. Do not drive yourself to the hospital. Let emergency responders come to you. Time is everything. The longer you wait, the higher the risk of permanent heart damage. But if you act quickly, doctors can intervene in time to prevent serious complications. Don't gamble with your life. If you feel unusual chest pain, take action immediately. Recognizing the warning signs quickly could mean the difference between survival and running out of time. Number 3. Difficulty breathing or shortness of breath. Imagine sitting still, not doing anything strenuous, when suddenly you feel like you can't get enough air. You try taking a deep breath, but it's not enough, like someone is squeezing your chest. If you think this is just a passing sensation, think again. Shortness of breath is not always just a part of aging. If you feel breathless without exerting yourself, your body might be warning you that your heart or lungs are in serious trouble. According to cardiologists, shortness of breath can be a symptom of heart failure, pulmonary embolism, or chronic obstructive pulmonary disease, COPD, all of which can be life-threatening if not detected early. When the heart fails to pump blood effectively, or the lungs struggle to exchange oxygen, the body reacts by making you feel breathless. Many older adults mistake this for normal fatigue, but in reality, it's a red flag that needs medical attention. If your breathlessness is accompanied by a dry cough, swollen legs, or chest tightness, you could be experiencing congestive heart failure. When the heart weakens, it doesn't pump blood efficiently, leading to fluid buildup in the lungs, making it harder to breathe, especially when lying down. Some people can only sleep propped up on pillows or sitting upright because lying flat worsens the sensation of suffocation. If this happens to you frequently, see a doctor immediately. Another dangerous cause of sudden breathlessness is a pulmonary embolism, which occurs when a blood clot travels to the lungs, blocking oxygen flow. This is an extremely dangerous condition that can become fatal within minutes. At first, it may just feel like mild chest discomfort or shortness of breath, but as the clot completely obstructs the lungs' blood supply, the situation can escalate rapidly. Pulmonary specialists warn that if you experience sudden, severe breathlessness, especially after prolonged sitting or lying down, or if one leg appears swollen for no apparent reason, it could indicate a blood clot traveling to the lungs. Do not hesitate. Call 911 immediately. Shortness of breath is not something to ignore. If you find yourself gasping for air after simple activities like taking a short walk, climbing a few stairs, or even while resting, pay attention. Ask yourself, when did this start? How long does it last? Is it accompanied by other symptoms like chest pain, leg swelling, or a persistent cough? If the answer is yes, you need to get your heart and lungs checked as soon as possible. Medical experts emphasize that early detection of heart and lung conditions can significantly improve quality of life and even extend lifespan. If shortness of breath has become part of your daily life, Don't accept it as just another part of aging. Instead, recognize it for what it truly is, a critical warning from your body. When breathing becomes difficult, it's not just a symptom, it could be your body's final call for help. If you're still watching this video and find these insights valuable, comment 3 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Number 4. Drastic and unexplained weight loss. Losing weight without trying might seem like a blessing, until you realize it could be a nightmare. If your clothes suddenly feel looser, the number on the scale is dropping unexpectedly, and you haven't changed your diet or exercise routine, pay attention. This could be a sign that something serious is happening inside your body. According to medical experts, losing more than 5% of your body weight within 6 months, without a clear reason, is a red flag that could be linked to conditions such as cancer, diabetes, or thyroid disorders. Our bodies maintain a natural balance between calories consumed and calories burned. When unexplained weight loss occurs, it means that your body is either burning energy at an abnormal rate or not absorbing enough nutrients. One of the most alarming causes of sudden weight loss is cancer. Certain cancers, such as pancreatic, lung, and colon cancer, can cause rapid weight loss even before other symptoms appear. As cancer progresses, it alters the body's metabolism, depleting energy reserves and leading to severe weight loss and muscle wasting. This is why many cancer patients first seek medical attention after noticing unexplained weight loss. Beyond cancer, type 2 diabetes is another major culprit behind sudden weight loss. When blood sugar levels are too high, the body cannot properly use glucose for energy. Instead, it begins to burn fat and muscle, leading to uncontrolled weight loss. If you frequently feel excessively thirsty, urinate more often than usual, or constantly feel hungry despite eating normally, these could be warning signs of diabetes. Another common cause is hyperthyroidism, a condition where the thyroid gland produces too many hormones, speeding up metabolism. When this happens, you may experience a racing heart, anxiety, excessive sweating, and rapid weight loss despite eating the same amount. If you suddenly feel more energetic than usual, but are losing weight quickly, get your thyroid function checked immediately. Unexplained weight loss can also be linked to gastrointestinal diseases, such as Crohn's disease or irritable bowel syndrome, IBS. When the digestive system is not functioning properly, your body fails to absorb nutrients from food, leading to weight loss despite maintaining a normal diet. If you experience abdominal pain, prolonged diarrhea, or bloating along with unexplained weight loss, your gut health could be at risk. So, what should you do if you notice unintentional weight loss? Don't ignore it. If your clothes suddenly feel looser, if you feel weaker and can't explain why, schedule a doctor's appointment as soon as possible. You may need thyroid function tests, blood sugar tests, lung x-rays, or digestive screenings to uncover the real cause. Number 5. Confusion, disorientation, or sudden personality changes. There's something terrifying about the feeling that your own mind is slipping away. Have you ever forgotten where you placed your keys, struggled to recall a familiar name, or lost a word mid-sentence? That's normal as we age. But if one day you wake up and can't remember how to get home, forget the names of your children, or experience drastic personality changes, it's no longer just about aging, it could be a serious warning sign. Sudden changes in memory or behavior can indicate dangerous conditions such as stroke, brain infections, or Alzheimer's disease. A stroke doesn't just cause weakness in the limbs, it can alter your thinking in an instant. If you or a loved one suddenly start slurring words, struggling to express thoughts, forgetting familiar places, or acting strangely, the brain could be in serious trouble. Another often overlooked sign is a sudden shift in temperament. Someone who was once kind and patient might become irritable and short-tempered, or a cheerful person might suddenly withdraw and become unresponsive. Brain infections, such as meningitis or viral encephalitis, can also cause a sudden onset of confusion, disorientation, or even hallucinations. Older adults have weaker immune systems, making them more vulnerable to infections that might seem mild at first, but can lead to severe neurological problems. If a loved one suddenly becomes unfocused, reacts sluggishly, and has a high fever, don't ignore it. Seek medical attention immediately. One of the most concerning causes of cognitive decline is Alzheimer's disease and other forms of dementia. This condition progresses gradually, but in some cases, the decline can happen more quickly. People with Alzheimer's typically forget things over time, but if you notice someone suddenly struggling to perform routine tasks, failing to recognize family members, or wandering aimlessly, it may indicate the disease is advancing rapidly. Take the case of Mr. Robert, a 72-year-old man who had always been sharp and loved reading. However, over the past few months, he started forgetting how to use his phone and even lost his way home after grocery shopping, something that had never happened before. His family initially dismissed it as normal aging, but when he became increasingly irritable, easily agitated, and frequently repeated the same questions, they took him for a medical evaluation. The diagnosis? Early-stage Alzheimer's disease. Without early intervention, his condition could deteriorate rapidly. So what should you do if you or a loved one suddenly experiences memory loss, confusion, or extreme personality changes? Don't ignore it. Seek medical help immediately to check brain function. Run tests on heart health, blood sugar levels, and perform MRI scans if necessary. Some conditions, such as anemia, prolonged sleep deprivation, or even depression, can mimic dementia, but they are treatable if caught early. Memory loss isn't always just a part of aging. Sometimes, it's a sign of something far more serious. If you notice any sudden changes in cognitive ability or behavior, take action immediately. When it comes to brain health, time is the key to protecting your future. If you're still watching this video and find these insights valuable, comment 5 below to let me know you're here, walking this journey with us toward a healthier, more meaningful life. Symptom 6. Severe and persistent abdominal pain. A passing stomachache might seem harmless. Maybe you ate something that didn't sit well, or your digestive system is simply reacting to an unfamiliar food. But if the pain doesn't go away, grows more intense, and is accompanied by symptoms like fever, nausea, or vomiting, it's not something you should ignore. Persistent abdominal pain can be a warning sign of a serious medical condition, one that could even be life-threatening. One of the most dangerous causes of severe abdominal pain is an abdominal aortic aneurysm rupture, a condition where the wall of the aorta in the abdomen weakens, expands, and eventually bursts. This is a medical emergency, as it can lead to massive internal bleeding and death within minutes, if not treated immediately. The telltale symptom is a sudden, stabbing pain that radiates from the abdomen to the lower back, sometimes accompanied by dizziness or a sudden drop in blood pressure. If you or someone you know experiences this, call 911 immediately. Another serious condition is acute pancreatitis, which occurs when the pancreas becomes severely inflamed due to alcohol consumption, gallstones, or infection. The pain from pancreatitis isn't just intense, it radiates to the back, often accompanied by high fever and vomiting. What makes pancreatitis especially dangerous is that, if left untreated, it can lead to multi-organ failure. Never underestimate severe upper abdominal pain paired with digestive distress. Then there's a silent killer that often goes unnoticed: stomach cancer. This disease progresses stealthily, with few obvious symptoms until it reaches an advanced stage. Some people might experience only mild bloating or indigestion, unaware that a tumor is growing inside them. If you have persistent abdominal pain, unexplained weight loss, loss of appetite, or blood in your stool, don't delay. See a doctor immediately. It's easy to mistake early symptoms for minor digestive issues, but catching this disease early can save your life. One of the biggest mistakes people make is waiting too long to seek medical attention. They take pain relievers, rest, and hope it will pass. But by the time they finally visit a hospital, their condition has worsened dramatically. Take Linda, a 72-year-old woman who was once active and healthy. One night, she developed intense abdominal pain. She assumed it was just gas or indigestion, so she took some pain medication and tried to sleep. By morning, the pain had become unbearable and spread to her back. When she arrived at the hospital, doctors diagnosed her with severe acute pancreatitis, which had already led to multi-organ failure. Had she sought medical attention earlier, her condition could have been managed. So what should you do if you experience persistent abdominal pain? Pay attention to the duration and intensity. If the pain lasts more than 6 hours, doesn't improve, or worsens over time, don't wait. Seek emergency care. If you have sharp, cramping pain accompanied by vomiting, fever, or pain radiating to your back, do not try to self-treat at home. Your stomach pain isn't always a minor issue. When your body is sending a warning signal, listen to it, because delaying treatment could cost you your life. Our bodies always have a way of sending warning signals before it's too late. Unusual fatigue, chest pain, shortness of breath, unexplained weight loss, sudden memory loss, or severe abdominal pain. Any of these could be signs of a serious health condition. The issue isn't just aging, it's whether we are truly listening to what our bodies are trying to tell us. The most important thing is to act quickly. Don't wait for the pain to go away, or convince yourself that it's nothing serious. The earlier a condition is detected, the higher the chances of successful treatment. Have you or a loved one ever experienced any of these symptoms? How did you handle it? Share your story in the comments to help raise awareness and prepare others. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss important health updates. Take care of yourself starting today, because your health is the most valuable asset you have.